So now you know the date of your surgery. So what can you do now to prepare for the smooth recovery? Let's start with the topic that everyone is very worried about, topic of pain. So if you have surgery, you're gonna have some discomfort, some pain. It's expected. There are gonna be several types of medication that you will be taking. One, Motrin and Tylenol. Motrin and Tylenol is non-steroidal anti-inflammatory medication that not only decreasing the amount of pain you're having, but it also decreases the inflammation and helps with healing process. This medication is great to take on a regular basis. So meaning 3 times a day, you have some food and you take Motrin and Tylenol. You can take them together because they work differently, or you can take them separately. And I usually tell my patients to take 600 milligrams of Motrin and 650 milligrams of Tylenol. And if you take this medication consistently on a clock for 1 to 2 weeks, your need for the narcotic medication will significantly decrease. It brings us to our second type of medication that you will likely take after surgery. Is narcotic medication, and you will get that prescription sent to your pharmacy. Narcotic medications is good for the breakthrough pain. Or for example, when you got home after surgery, had that bumpy ride and you feel a little bit sore, and Motrin Tylenol is not touching that soreness. So it's totally fine to take the narcotic medication. Keep in mind that if you take narcotic for a long period of time, you can develop a constipation that can be hard to treat post-operatively. But saying that, don't be afraid of taking the narcotic medication. We do need to have your pain under control. Another medication that I find very helpful, especially if you had robotic or laparoscopic type of surgery, is Gas X. This medication helps not only with removing gas out of your bowel, but it also helps with that gas pain that people experience after laparoscopic procedures. And heating pad can also help with the gas pain, help to relax the muscles. So I definitely recommend getting a heating pad before your surgery. Make sure to get abdominal binder. You can ask your doctor to be sent home with one or buy it on Amazon or local pharmacy. Another item on the list to get is compression stockings. Again, surgery is a risk factor for developing a blood clots. When you have a surgery, you do have special devices that helps with your circulation. When you get home, we do want you to keep walking around, make sure that the blood is flowing in your legs and you're not forming a blood clots. However, because you have pain, you're probably not gonna do your normal physical activities. So I recommend to wear compression stockings anytime you're resting in your home or just starting to be more active. If you're out of town patient, I will definitely require you to get the compression stockings and fly home with compression stockings on. Another topic to address is the bowel and urinary function after surgery. So it's normal to not have bowel movements for several days after surgery. But what's helpful is to start taking Miralax, even half of the normal dose of Miralax, every day starting after surgery. It might be scary to have a first bowel movement after surgery. When you feel like you have a bowel movement and you sit on a toilet but it's just not coming out, get up and leave the toilet. Come back the next time. Try to avoid sitting on a toilet for a long period of time and straining, because you don't want to increase abdominal pressure and put extra strain on your recent surgery. The pain medication can cause the constipation, and just the surgery on its own can irritate the bowel because it can be touched during the surgery and can cause constipation. Heating pad can be very helpful with relaxing your pelvic floor muscles and helping with the first bowel movement. So how about urination? So you probably had some work done in the vaginal area on your urethra. And when you pee, you might feel that your stream is not very normal. Like you might feel like you're spraying or it's a little bit weaker. Do not panic. it will get better with time. You might also notice a little bit of pinching and burning when you pee, because when the urine comes out, it touches the suture line, the fresh suture line, and it can cause some burning. So what can you do? You need to get a peri bottle, and you can get it at Target, on Amazon. So when you're about to start, pour the warm water on your genital area. That will dilute the urine and will decrease the amount of burning that you experience. In some cases, because there are a lot of work done on your vaginal organs, on your bladder, the tissue gets swollen and you can't pee right away after surgery. In those cases, you will get the catheter placed after surgery, and you will get the instructions on how to handle and taking care of the catheter. Usually, you will be asked to keep a catheter in anywhere between 1 to 7 days, and then you will go to the doctor's office and they will remove the catheter and you will try to pee on your own again. If you were able to pee after surgery, you're not going to have a catheter placed. But if you notice that it's getting harder to pee when you're at home and it's been 4 to 6 hours, you haven't been able to pee, make sure to call your doctor to get the urinary catheter placed before bladder gets too full. Be aware that you will have some vaginal bleeding, so make sure you have a sanitary pads and panty liners at home. You're not going to be allowed to use the tampons. Things to keep in mind: if you start developing heavier bleeding and you're changing pads every hour, that's definitely not normal. Make sure to call your doctor. And when the bleeding resolves, you might notice more of vaginal discharge. And it's totally normal because all the sutures in your vagina start dissolving. And it might come with this not very pleasant smell, and you might even notice the pieces of suture when you wipe. It's totally normal. So how about the activities after surgery? Well, you will be able to walk around, take stairs after surgery, take a shower next day. But try to avoid bathtubs or hot tubs for at least several weeks until you get a green light from your doctor. You can start going on the walks, but keep in mind, take it slow and listen to your body. The main thing that we want to try to avoid is anything that increasing abdominal pressure. So heavy lifting or sit-ups, try to avoid those activities. And here's the question that all significant others want to have an answer to. When can I have sex again? So everyone heals differently. Some people can resume sexual activity at 4 weeks, but majority needs to wait till 6 weeks. If you are out of state patient, I would want you to wait a full 8 weeks, just because I can't examine you and I want to make sure that you have a best chance at healing. If you feel like you're at 6 weeks mark and doctor tells you, okay, you're good to go, but you're not ready, just take your time, wait, and let your body heal. So what can you eat after surgery? There are no hard and fast rules about what you can and cannot eat after surgery. Initially, when you wake up after surgery, you probably will be given like some crackers and some water to make sure that you can tolerate it. You're not going to have a big appetite the first or second day after surgery because of the anesthesia. You probably will want some comfort food. Obviously, do not overdo it. It doesn't mean you need to go on a full liquid diet or drastically change what you eat. Just wait a couple of days until having that steak dinner. Make sure that you stay hydrated, especially in the first couple of days, to flush out all the anesthesia out of your body. Regarding the alcohol, I would say wait until you stop taking all narcotic medications, because narcotics and alcohol is never a good combination. Having surgery is stressful, but if you're prepared and you know what to expect and have all the necessary items ready for you at home, the recovery will be smooth. It will give you the best chance for having a great outcome after your surgery.